fluid behind the eardrum.
Is that when tubes are necessary?
Usually we would go not only by the tympanogram but also a hearing test. If a child had fluid in their ears and had a mild hearing loss of 20 decibels or so, we would be willing to watch that for a while. If they were a school-age child and had a greater hearing loss in the neighborhood of 30 to 40 decibels, we would not want to watch that too long in terms of conservative management. We would feel like that is an unacceptable hearing loss in a school-age child to let that go for 6 months, as the tape might have implied.
What do you think about recent reports that tubes are overused?
It's hard to say, Karen. Most of the children that come to see us are referred by their family doctor or their pediatrician. They've already been on numerous antibiotics. They've already been to the pediatrician numerous times before we ever see them. So it's hard to know for sure statistically how many of these children could get along with further medication or observation or watchful waiting versus the tubes. I think that we would go primarily on how many ear infections they've had and what their hearing loss is, and we would determine it more by that than trying to set some standard time frame in terms of watching fluid in the ears.
Do you think one reason for chronic ear infections is that we're not following through with medication properly, or is it a deeper problem than that?
It's probably not really necessarily related to medication. There are all kinds of new antibiotics on the market. In some ways, possibly antibiotics are overused. It still has to do with the development of the eustachian tube and the nasal pharynx, the back of the nose, and that area of the anatomy allowing air to enter the middle ear and keep the middle ear free of fluid.
One quick problem, swimmer's ear. Any comment on that locally?
We're seeing a lot of swimmer's ear, of course, in the summertime. It probably causes the most painful ear infection there is. You can almost tell by looking at a person with a swimmer's ear that that's what it is, just by the amount of pain they're having. We recommend that if a person is prone to swimmer's ear, to use earplugs for swimming, to use alcohol in their ears after swimming to dry out excess moisture in the ear.
All right, thank you, Dr. Neal, for joining us.
Thank you.
By the age of 30, most people begin to notice some fading in their ability to hear. Often a hearing impairment develops slowly over time, so people may not notice that they're having a problem. This time on Health Matters, we're talking about hearing loss and ways to correct it. Hearing aids can sometimes help, but surprisingly, only 15% of all hearing impaired individuals actually wear the devices. It may be that some people are too embarrassed to wear them. Listen to what one hearing aid user has to say about that.
My advice to them would be to at least go to the doctor, try one in your home without telling anyone if you're ashamed of that, and listen to the sounds that you've missed, because you're going to miss out on half of your life without a hearing aid.
Joining us here in Lubbock is Dr. William Ullum from Methodist Hospital. Dr. Ullum, do you find that too in your practice, that a lot of people are just afraid to try a hearing aid?
Surely. Many people are afraid to try a hearing aid. They're afraid from the standpoint of the cosmesis that's involved, as well as being concerned as to the effectiveness of the hearing aid. These things you alluded to just a moment ago.
Can you describe how it works?
If I may, I would like to go to a chart I have here.
Sure.
To reiterate some about normal hearing, sound vibrations come in through the external auditory canal. They're collected on the eardrum and then pumped across the middle ear by this little chain of bones to the fluids of the inner ear. This little structure here is called the cochlea, and as pointed out previously, there are little hair cells that are stimulated by the vibrations in the fluid of the cochlea. Those create electrical sounds that are then carried to the brain by this nerve as sound. Now, a hearing aid, well, first off, hearing losses can occur any place in this chain. But generally speaking, a hearing aid is simply an amplifier. It consists of a microphone, a power source, such as a battery, an amplifier, and then a loudspeaker. And most of our hearing aids that we fit today fit into the outer part of the external ear here, and sounds are simply amplified to the point as that the energy that comes through here is much greater than without the hearing aid to stimulate the little hair cells within the cochlea.
How can a patient be sure then that the hearing aid that they wear will amplify conversation and not just make noise louder?
Really, that cannot be determined except by a thorough evaluation process and by the individual using a hearing aid for a period of time to simply see how it works.
And are there other options? Like if one hearing aid isn't very effective, can you go then to something else?
There are a multitude of different types of hearing aids. There are a multitude of advancements going on in that field.
You know, I wonder if a lot of people give up. They've tried it once, think, well, it didn't work for me, and don't realize they can go on and try other things.
I'm sure there are a lot of people that do that.
How expensive are hearing aids?
Hearing aids will vary in price from $600–700 up to as much as $1,200. Some hearing aids are rather complicated, and then some of the newer aids that have newer features are more expensive. They'll run into the range of $1,500 a piece.
Do they last permanently?
No, a hearing aid doesn't last permanently. I wish that we could say yes, but it's like anything else, such as a radio or TV or what have you. It's going to wear out. There's a finite life to a hearing aid.
Do you think that insurance would cover it, though, for most people?
Well, for most people, insurance doesn't cover a hearing aid. Most insurance companies look at hearing aids as they do glasses. Now, if a hearing loss has come about from an automobile accident or from a traumatic experience, oftentimes they will cover them. Sometimes if the hearing loss has come about from some particular catastrophic illness or something of that nature, such as meningitis, it can be, sometimes is included in the reimbursement plan.
What about a cochlear implant? Who's a good candidate for something like that?
Cochlear implants are newer things. They've just come about in the past few years, but they are really a breakthrough. The cochlear implant is reserved for that individual who has a near total loss in both ears and cannot use a hearing aid. Such conditions can come about from meningitis. Some people, from other reasons, will lose all the function of the cochlea. Under these circumstances, it doesn't make any difference how much you amplify the sound through here. The cochlea still can't respond. So by surgery, the little cochlear implant is introduced from the middle ear and threaded through this little window here into the cochlea itself. It's a little tubular affair, and the ones that are used nowadays have about 23 channels to transmit electrical impulses. The little external portion of it is behind the ear. It picks up sounds, and then the sounds are ultimately converted into direct electrical energy that's carried into the cochlea to stimulate the branches of the nerve directly.
Well, that is an exciting new development. I know a lot of people are prospering by that and hearing finally. We appreciate your being with us today to talk about hearing aids as well. We hope our program today has helped you learn more about premature hearing loss and ways you can protect your ears. I'm Karen McKay. Join us again next time because health matters.